When Dr. Amy Cullen reviewed a recent federal audit criticizing Orange County's managed health care plan for jeopardizing the health care of 16,000 seniors, the 44-year-old Costa Mesa resident saw herself.
I wasn't getting the care that I needed. They denied coverage for things that they should have covered, and it's so frustrating.
A scathing November 2013 federal audit criticized CalOptima's One Care program for improperly denying prescriptions and medical services in a program designed primarily for elderly members. Cullen said that's exactly what happened to her and made her lupus symptoms worsen over the past 2 years.
I have regular injections every 3 months from a neurologist, and these had been covered by CalOptima normally, and so I was supposed to go to my appointment, and less than 24 hours before my appointment, suddenly they denied coverage. They said I didn't need to see my neurologist and I didn't need to have my injections. I have no idea why they didn't cover it this time. I tried appealing it, and they denied it. Finally, it got overturned, and I was able, about a month later, to go to my appointment. In the interim, I did try and make appointments with the doctor that they sent me to. I couldn't even get through on the line. It would go to voicemail. I left messages on the alternate, physicians that they sent me to on their voicemail. I even sent them a fax. I wouldn't get any response.
Meanwhile, what's happening to your
condition? I got worse. I continued to get worse. I started having a flare-up of my central nervous system lupus symptoms. I was having trouble walking. I was having trouble with my vision. And I was having continuous migraines. And that's what I was... Yes, and that's what I was having the treatment for. So I went in to see my neurologist once they finally had overturned the decision, and she noticed that I, aside from having all of these other neurologic symptoms that I just described, she noticed that I had weakness in my right arm. I had started having clumsiness. I was dropping things with my right arm, and I've never had that before. And so she was very concerned and thought I might be having a stroke. So she immediately admitted me to the hospital. I'd even talked to somebody that day from CalOptima, and they said that, it shouldn't be any kind of an issue with the admission. My doctor would talk to somebody from CalOptima. While I was in the hospital, they also found another abnormality and had to talk to neurosurgeons to see if they needed to do surgery while I was in the hospital. Well, after I was discharged, I got a denial letter. A cardiothoracic surgeon at CalOptima had reviewed my case and decided that it wasn't medically necessary for me to be in the hospital. He decided that, possibly having a stroke wasn't justification for being admitted. I mean, that's ludicrous.
And what happened? What was the impact of that decision?
I still am fighting it.
Did they charge you for it?
I don't know what's going to happen. That hasn't happened yet. I appealed it, and then that got denied again. So now I'm going to do an appeal with the state of California to ask for an independent medical review. So they made me worse, and now they're not covering the hospitalization that they caused.
Do you feel like CalOptima made you sicker?
Yes, and definitely the stress didn't help. And stress definitely isn't good for my disease.
State auditors are now checking whether the problems are system-wide, yet given her experience, Cullen says they shouldn't have far to look.
They need to review what's being done with patients. I mean, their denial process, the rate of denials, it makes no sense. They need to review the physicians that are doing these reviews, because that doesn't make sense to me either. I was receiving prescriptions. There was a medication that was approved. I was getting it regularly. One Friday evening, I went to the pharmacy to get this prescription, and suddenly it wasn't authorized. So I wasn't able to get this medication for several days. Of course, over the weekend, they couldn't reach my physician, and so I ran out. Now, if I were a diabetic and I couldn't get my insulin, or say I had uncontrolled high blood pressure and I couldn't get my blood pressure medication, this could be disastrous. I think doing this sort of thing to patients, this can be very dangerous. And if they're doing this sort of thing on a widespread, basis, For a lot of patients who don't have a good understanding of their disease process, they're probably just saying, forget it. I won't take my medication. And then this results in them having to go to the emergency department because their diseases are getting worse. That causes, healthcare costs to go up, and people are just getting sicker. If they're, just looking at from a cost standpoint, they're costing the state more money because they're providing bad care. When they cut off access to people's prescriptions and their regular follow-up, people get sicker. They disrupt their continuity of care. It's going to cost more money. It was awful. This was an awful 2 years. I feel sorry for people, who have this coverage.